Past president from 1996 to 1998, Dr. Peter Rosenbaum is a developmental pediatrician whose work has served to influence the way many in the field, including the families, think about childhood onset disabilities and how to best support the child's function, development, and well-being. He is a vocal and passionate leader with a sharp wit and a dry sense of humor who has blazed a trail of research rigor, seeking to answer the questions to what is most meaningful to individuals with cerebral palsy and their families.
When I started my training in the late 60s, developmental pediatrics didn't exist. I had in effect, a functional approach to what I ended up doing, which was that I knew what I was interested in, and I knew what I was not interested in. I didn't have a particular passion for the biology of the health issues in kids. I did have a particular interest in children and families in long-term illness and in working with children and families in the community. And for social reasons, I knew I was going to go and do some training in London, and spoke to 3 friends at the Hospital for Sick Children in Toronto. And I spoke to them independently. They had all spent time in London and described the functional profile of what I was looking for. And they gave me the same answer independently, which was to try to go to the Institute of Child Health and to the Wolfson Center, which was just starting a focus on what we now call developmental pediatrics. And so with the help of the professor of pediatrics at University of Toronto, I was able to get a fellowship, in fact, 2, which allowed me to go for a year and stay for 3, and found my métier, my career.
That's wonderful. And we're so fortunate that you found that, and that you found a good fit for yourself.
Yeah.
In more of a social sense than that biological sense. Can you tell me a little bit about your mentors and who helped you along the way?
Well, the professor of pediatrics in Toronto, I owe him a lot, partly because his secretary was my wife's aunt, and that's how I met my wife. But I knew him quite well, and he was very supportive. And I say that because there were others to whom I described my interest who kind of poo-pooed it. And that's a whole other story, but I really should be doing genetic studies, and I should be understanding the biology of disability. And Harry Bain was very supportive, and as I say, wrote letters to support my getting a fellowship. So he was the first one. And then Kenneth Holt, who was the first professor of developmental pediatrics in the UK, had trained with a man named Ronald Illingworth in Sheffield, and Kenneth was appointed to the professorship at the University of London, and he was very instrumental in my thinking, in part because he had assembled a very skilled and well-known group of people, 2 psychologists, Joan Raynell and Michael Huntley, an excellent physio, an excellent OT, an excellent speech-language therapist, and an excellent social worker. And it was from these people that I really learned the most. I learned a lot from the pediatricians, Kenneth Holt and Joan Raynell, but it was these other people whose professions I knew nothing about. And they were a very effective team. They worked together as a team. I attended team meetings regularly. I presented the cases I was seeing. I sat in with them, and it was this amazing environment that empowered me to make sense of what I was learning.
When you were working in the assessment clinic and you had this amazing team, what were some of the qualities of the mentors that you learned from, or what were some of the things that struck you?
Patience, CE, willingness to teach, willingness to explain, clarity of language. They didn't try to baffle us with jargon, and were really open to answering questions, discussing things, also listening to them talk with each other. And seek more detailed understanding of what one of them said. Another one might say, well, I don't follow this or whatever. So there was a kind of a climate and an atmosphere where it was, excuse me, it was okay to ask questions. It was okay to not understand. It was okay to have a different point of view.
Right, right. That seems very important these days. People aren't necessarily accepting of having different point of views. So it's definitely something to learn from your mentors. So moving on to the Academy and why we're here for this interview, who were some of your most cherished friends within the Academy?
Well, when I joined the Academy, I was obviously quite young. I joined in 1974 and attended the first meeting I ever attended was in Denver in 1974. Began and then attended almost every year after that for almost up to the present.
Yeah.
And I remember one of my young colleagues who was a very bright academic, and he and I did some presentations together, and they used to refer to some of the old guard as the old farts. And then one year he looked at me, he said, "We're becoming the old farts." What was so interesting this is David Cadman, who was a close colleague and friend for many years. What was so apparent is that David had very, very solid academic training in research methodology and research thinking and critical appraisal. And we were becoming aware that much of what we were hearing was, in my opinion, in my experience, I've seen a lot of it, and I don't want to be too rude about that, but I think that was not academically sound. And so some of us were becoming aware that we were needing to put onto a firmer footing what we were doing, justifying or explaining how we were thinking about things. And that was a very useful experience. That is in no way to put down the old guard, because quite frankly, the old guard were the people who had a passion for childhood disability a long time before most people did, and had the courage to pursue those issues and those interests when other people were rolling their eyes and thinking that we were kind of second-class professionals. So there was and remains a very strong commitment to child well-being, and increasingly to family well-being.
How do you think the field has changed?
Unrecognizable. I often, when people ask that kind of a question, I say I'd love to go back to just reflect on what I was being taught and what I was learning in 1970. And the field is unrecognizably different, mostly because I think, as I said earlier, I think the spotlight has become much bigger. The spotlight used to be on the diagnosis and on the odyssey to make the right diagnosis, and then the interventions, which were almost entirely biomedical.
Right.
At least in the mainstream. And then particularly in the last 20 years with the World Health Organization's thinking about health more broadly, the spotlight's gotten a lot bigger. And in addition to the focus on the biomedical, there's a focus on, well, how does the biomedical affect you in day-to-day functioning? Yeah. And how does it affect whether and how you can do what you want to do, which they call participation, and which I think is fundamentally important, because it's been brought right onto front of the stage. And then an expectation that not only do we think about personal factors, which everybody knows are important, and environmental factors, which everybody knows are important, now these are formally part of the framework of health. And so we now have a biomedical, psychosocial framework of biopsychosocial, biological, the psychological, and the social integrated into one component. And now we can ask questions about, why are we doing this? And what do we hope to achieve with this? And is this the best way to achieve it? Is this a relevant thing to achieve? And so on. And that is fundamentally more exciting than it used to be.
Absolutely. And I think I think so much of this goes back to what we just discussed, your contribution to this, and being able to translate it to the families ultimately being able to understand it. And
well, I think I will accept that we've we've tried to be cute about it with the F words.
Yeah.
And that was really a tongue-in-cheek kind of throwaway idea. We wrote a paper and it got published, and 10 years on, the paper's been downloaded almost 50,000 times.
Yeah, it's got some legs.
Translated. The ideas have been translated into 35 languages. So we've been able to bring some plain language thinking to this, but the World Health Organization really started it all. I think I told you that one of the most profound 7-word sentences in my whole career was said to me by a parent who's been part of a research study we've completed, and now is a co-investigator with us on other projects. She said, "You have textbooks, we have storybooks." And that is just such a beautiful encapsulation of the complementary perspectives of medically trained health professionals who think about primarily what's going on, what are the underlying causes, and so on, and the individual realities, the individual predicaments of the people whose kids have it.
Is there advice for current academy members that you'd like to highlight?
Yeah, ask, don't ever say we can't do that. Ask, why can't we do that?
Yeah.
Be curious. Ask questions, be comfortable to think outside the box. Get rid of the box, actually. I think that we should stop thinking outside the box and just get rid of the box altogether. I think it's always okay to ask questions. It's not okay to be cynical. It's not okay to just ignore things. But I think we should be prepared to recognize how much has changed, how much is changing in our field, sometimes because of people in our field, and lots of times because of things going on around us. Mm-hmm. One of the most dramatic examples, I suppose, is that the current political climate in 2022 involves people having much less respect for expertise than they used to. Yeah. And Dr. Google is in her office 24 hours a day. So we now have to be more modest in our expectations of ourselves, because there's a lot of other information out there. I think we need to be prepared to listen always to parents' dilemmas and to try to understand what's underneath the question that they're asking, to be supportive, and most particularly, I suppose, to take a positive view of things, to take a strengths-based view of things. I sometimes introduce myself when I lecture as a non-Asian, non-woman, which is, I think, visibly true and tells you absolutely nothing about me. And I use that to caricature our classical approach to the catalog of doom of things that kids won't be able to do. And I don't think that's helpful to anybody. What I think is helpful is to talk about what, first of all, to find out from parents, what can their kids do? What do they like about their kids? And what are their aspirations for their kids? And what are their kids' interests and aspirations? And how can we facilitate that, even if they end up doing things differently? Most of us are not world-class at anything, but we have traditionally expected kids to learn to do things and do them nicely and do them normally, and kind of, get after them if they're not walking nicely, or if they're not talking nicely. I want to know what they're going to do with their walking. I want to know what they're going to do with their talking. And can we engage kids and families in ways that are about child and family development and being and becoming and belonging?
Beautiful advice. Thank you. What gives you hope?
Oh, looking back. If you were to interview me the first day I went to my training in London and said, what do you think the field's going to look like? I probably wouldn't have had a lot of imagination, but I sure as hell would not have imagined that we'd be where we are now. And that gives me enormous hope.
And how do you want to be remembered?
Somebody who had fun, who asked questions, who had the courage of his convictions, who wasn't put off by being told that what I did was, it must be, many of us actually have been told, you must be very dedicated, which is a snide way of saying, why the hell couldn't you get a proper job and be a regular doctor or a regular health professional? And that's never bothered me. And, I've had the courage of my convictions. And I hope that people will, be comfortable to try to take that approach to things and not be put off because you can't do it.